Signs of diabetes you can't ignore. Your body gives off indirect signals that could indicate if you're at risk for diabetes, and recognizing these signs can make a big difference. Diabetes doesn't just happen overnight, it often gives clues along the way. Catching these early signs can help protect your health and prevent complications down the road. Diabetes affects millions of people around the world, but the good news is that early detection can make all the difference. Taking small steps can lead to big changes tomorrow, especially when it comes to keeping your blood sugar in check. Don't go anywhere. Coming up next, we'll talk about the early warning signs of diabetes that could change how you think about your health. Number 15, mood swings could be a sign of diabetes. It might be more than a bad day if you're feeling cranky a lot or your mood changes suddenly without any clear reason. One possible reason could be diabetes, which hasn't been diagnosed yet. When your blood sugar gets too high or too low, it can mess with how your brain works and make you feel upset, tired, or even sad for no clear reason. These emotional ups and downs can be confusing, but the good thing is they don't last forever. When your blood sugar levels are brought back to a healthy range, your mood often improves, too. It's like your body and mind start working together better again. If you're going through mood changes often, especially along with other symptoms like feeling very thirsty, tired, or needing to pee a lot, it's a smart idea to get your blood sugar checked. Talking to a doctor can really help you understand what's going on and how to feel like yourself again. Number 14, sudden weight loss could be a sign of diabetes. If you've noticed that you're losing weight without even trying, it's something worth paying attention to. Sudden weight loss can be an early sign of diabetes, especially type 1. Normally, our bodies use sugar from food to give us energy, but when you have diabetes, your body can't use sugar properly. So, instead of using sugar for energy, your body starts breaking down fat and muscle to keep going. This can cause you to lose weight quickly, even if you haven't changed what you eat or how much you exercise. It might feel strange or even worrying if your clothes are getting looser and you don't know why. But this weight loss is a sign that your body needs help. So, if you or someone you care about is losing weight unexpectedly, getting checked out is a good idea. It could help you feel better and take control of your health sooner rather than later. Number 13, itchy skin and nerve damage from undiagnosed diabetes. If diabetes goes undiagnosed, high blood sugar can start to cause problems in your body, including nerve damage. This nerve damage usually affects areas like your hands and feet, and it can lead to itching, which can be pretty uncomfortable. When your blood sugar stays high for a long time, it can also harm your blood vessels, making it harder for blood to flow properly. Poor blood flow, or circulation, can make your skin dry and rough. This dryness can cause your skin to feel itchy. In some cases, it might even start peeling. If you're noticing any of these signs, it's really important to get your blood sugar checked and talk to a doctor. Taking care of it early can prevent further damage and help you feel better. The sooner you take action, the easier it will be to manage diabetes and keep your skin and nerves healthy. If you've been dealing with itchy skin or other symptoms, don't wait. Getting checked is the first step to feeling better and staying healthy. Number 12, erectile dysfunction and other sexual issues related to diabetes. Erectile dysfunction is a common issue for men with type 2 diabetes, making it difficult for them to get or maintain an erection. This happens because high blood sugar over time can damage the nerves and blood vessels that help blood flow to the penis. As a result, men with uncontrolled diabetes may struggle with sexual health. However, sexual problems aren't just something men face. Women with diabetes can also experience difficulties, like having less interest in sex or not getting enough natural lubrication. Though these issues may be less talked about, they can still affect a woman's sexual health. Research on how diabetes impacts women's sexual health is ongoing, and the findings aren't as clear as with men. Should you have any diabetes-related sexual problems, it is advisable to consult a doctor who can guide you with diagnostic, therapeutic, and supportive options. Taking action early on these matters can help you cope with them much better. Therefore, if sexual health problems bother you, a medical specialist can provide you with appropriate therapies to restore your well-being. Number 11, always feeling thirsty? Have you always felt thirsty, no matter how much water you drink? If this is happening to you, it might not just be because you're hot or tired, it could be something else, like diabetes. When your blood sugar levels are too high, your body tries to get rid of the extra sugar through urine. But to do that, it pulls water from other parts of your body, leaving you feeling thirsty again and again. This constant thirst is known as polydipsia. Usually, there is another sign that goes along with this thirst: more frequent visits to the restroom. If you are consuming a lot of food and fluids and urinating more than normal, that could indicate an issue with your body. Do not ignore or take such symptoms lightly, as they might indicate something is wrong with your body. If this resonates with you, it would be wise to evaluate your blood sugar levels. The diagnosis of diabetes ought to come as early as possible, as the sooner you know, the easier it becomes to manage and avoid complications. If you or a loved one is unusually feeling thirsty all the time, it is probably time to consult a physician. Number 10, fruity smelling breath and what it means for diabetes. It might seem odd, but this could be a sign of something serious, like diabetic ketoacidosis, which is a condition linked to diabetes. Normally, your body uses insulin to turn food into energy. But if your body can't use insulin properly, it starts breaking down fat cells for energy instead. As it does this, your body produces something called ketones. These ketones can make your breath smell sweet, like fruit, or even like acetone, which is the chemical found in nail polish remover. If you notice your breath has this fruity scent, it's important to take it seriously, as it could be a warning sign of diabetic ketoacidosis. This condition is a dangerous complication of diabetes and requires immediate medical attention. Number 9, always feeling tired? Everyone feels tired sometimes, but if you're always feeling worn out no matter how much you rest, it could be a sign that something's not right inside your body. One possible reason is high blood sugar. When your body isn't using sugar the right way to give you energy, you can feel weak and tired all the time. It's not the usual tiredness from playing too much or not sleeping enough, it sticks around and makes it hard to do your everyday stuff. If getting out of bed feels tough or you just don't have the energy like before, it's worth checking out. The doctors at many clinics know how to look into this kind of tiredness. They can test your blood sugar and other things to see what's causing it. Getting the right answers means you can start feeling better and enjoy your day like you used to. Number 8, tingling or numbness in your hands and feet could be a warning sign. Have you ever felt a strange tingling or numb feeling in your hands or feet that doesn't go away? You might feel like pins and needles or sometimes even like a burning or sharp pain. This could be a sign of something called diabetic nerve damage. When someone has high blood sugar for a long time, it can start to hurt the nerves, especially in the hands and feet. Initially, it may feel like an inconvenience, but with time, it can become a serious issue and even make it hard to feel sensations. This is why you must get it examined sooner. Prevention and early treatment can go a long way in making sure you are more relaxed and decreasing the chances of serious problems later. Number 7, nausea and vomiting. If you've been feeling nauseous or throwing up more than usual, it might be more than just an upset stomach, it could actually be linked to diabetes. One possible cause is nerve damage, known as neuropathy, which affects how your body moves food from the stomach to the intestines. When the nerves aren't working properly, food can get stuck in your stomach, making you feel queasy or even leading to vomiting. This kind of digestive problem is often seen in people with long-term diabetes, especially if blood sugar levels have been high for a while. If you have been experiencing these signs, it might be worthwhile to reflect on how diabetes may potentially be affecting your gastrointestinal tract. A licensed medical practitioner will be of tremendous value in unraveling the underlying causes and in helping you set actionable goals for your general health. Being proactive, altering your lifestyle, and increasing the number of visits to a healthcare provider for examinations can greatly enhance one's life and lessen future problems. Number 6. How high blood sugar can make you feel dizzy. We've all felt lightheaded or dizzy from time to time, usually because we're tired or hungry, and that's pretty normal. But if you have diabetes, dizziness can happen even when your blood sugar is high. When your blood sugar levels are too high, your body tries to get rid of the extra sugar by making you urinate a lot. This causes your body to lose water, and without enough water, you can start feeling dizzy or lightheaded. Not only can dehydration make you feel dizzy, but it can also affect your brain. When you're low on water, your brain doesn't work as well, which means you might have trouble concentrating or remembering things. If you've been feeling lightheaded often and it doesn't seem to go away, it could be a sign that your blood sugar is too high. It's a good idea to check your blood sugar levels and talk to a doctor to find out what's going on. Getting the right treatment early can help you feel better and keep dizziness from becoming a regular problem. Number 6. Going to the bathroom a lot. If you're finding yourself running to the bathroom more often than usual, especially at night, it might be more than just drinking too much water. One of the reasons this can happen is because of high blood sugar levels, which can affect your kidneys. When there's too much sugar in your blood, your kidneys work harder to get rid of it, which leads to your body producing more urine. This causes you to need to go to the bathroom more often. This condition is called polyuria, and it's actually one of the early signs of diabetes. It's your body's way of telling you something might be wrong. If you find yourself waking up several times at night to relieve yourself, or if you are going significantly more frequently during the day, it's prudent to seek medical evaluation. Therefore, don't dismiss the increased urination. These may be indicators warranting further scrutiny. Number 5. How diabetes can affect your body's ability to fight infections. If you have diabetes, your body might find it harder to fight infections, which means you could get sick more often. High blood sugar may make it more difficult for your immune system to work the way it should. White blood cells, which are the body's defenders against illness, struggle to do their job properly when there's too much sugar in your blood. This can lead to infections in places like your skin, bladder, or even areas like the vagina. Yeast infections are also more common in people with diabetes because the extra sugar creates an environment where harmful germs can grow. These infections can be tough to get rid of, and if they keep coming back, it might be a sign that your diabetes is not under control. If you notice you're getting sick often or have infections that don't seem to go away, it's important to talk to a doctor. They can help you manage your blood sugar levels, which will help strengthen your immune system and reduce your chances of getting sick. Taking care of your diabetes can help you stay healthy and prevent infections from becoming a bigger problem. Number 4. Slow healing wounds could be a sign of high blood sugar. If you notice that small cuts, bruises, or scrapes are taking a really long time to heal, it might be more than just a skin problem. High blood sugar can make it harder for your blood to flow properly, which slows down the healing process. That's why people with diabetes often find that even tiny wounds just don't go away as quickly as they should. On top of that, the body becomes weaker at fighting off germs, so infections can keep coming back. This can be uncomfortable and frustrating, especially when you're trying to stay healthy. These signs might seem small, but they're actually important clues that your body needs some help. Many hospitals and clinics understand these problems well and offer treatments that can help wounds heal faster and stop infections from getting worse. Getting the right care early can make a big difference and help you feel better sooner. Number 3. Catching diabetes early can make life easier. Finding out about diabetes early can really make a big difference and make life a lot easier. The sooner it's caught, the better you can manage it and continue living a healthy, fulfilling life. You don't need to make huge changes all at once, just small, manageable steps can go a long way. Things like choosing healthier foods, staying active every day, and visiting the doctor regularly can help keep your blood sugar in check and reduce the risk of complications down the road. The best part is you don't have to do it alone. Many hospitals and clinics are here to support you every step of the way. They have the right tools to help you plan your meals, offer fun ways to stay active, and give you tips on managing your blood sugar. Their team is always there to answer your questions, provide guidance, and help you make the healthiest choices for your life. By making small changes today, you can avoid bigger problems tomorrow and, most importantly, feel better. Number 2. What dark patches on your skin could be telling you. Sometimes, people notice dark patches of skin showing up around their necks. These spots can also feel a bit thicker or wetter, almost like velvet. They don't always cover a big area, they might just appear in the folds of the skin. These patches might also be seen under the arms or near the groin. This skin change is called acanthosis nigricans. It often shows up in people with type 2 diabetes, especially those who have darker skin tones. What's happening is that the body might be making too much insulin, and that extra insulin causes the skin cells to grow faster than usual. That's why these patches appear. It might seem small, but this could be the body's way of saying that something's not right. If someone sees these kinds of changes, it's a smart idea to get checked by a doctor. Finding these signs early can help people stay healthy and get the help they need. Number 1. Blurry vision. Your blood sugar might be the reason. If your vision sometimes goes blurry and then clears up again, it might not just be your eyes getting tired. It could be because of high blood sugar. When sugar levels in your body go too high, it can affect the lens inside your eyes, making it swell. This swelling makes it harder for your eyes to focus clearly, and that's why things might start to look blurry. This can happen off and on or stay around for a while. Even though it might not seem like a big problem at first, it's actually something that shouldn't be ignored. Changes in eyesight could be one of the early signs of diabetes. That's why getting your eyes checked is important if this keeps happening. Keep in mind that knowing the condition at an early stage is vital when aiming to enjoy a fulfilling and vibrant life. Always remember to look out for those informative signs, act on them, and do not shy away from contacting your doctor if you feel something is not right. After all, your health matters. Have you noticed any signs of diabetes in your body? Don't wait, take charge of your health today. Like and share to help others stay informed and healthy under the sun.